today. So on behalf of Mr. Majors and everyone else at Glencliff, I would like to welcome you. There are positive things that go on at Glencliff every day. And what's amazing to me is how much they align with what's going on in the city. And that's by design. We've done that on purpose. But we are thrilled anytime we get the opportunity to show the great things and showcase our students. I want to thank everybody for coming. I would like to specifically mention a few people. Our House of Representatives member, Janice Santani. She is our neighbor. We lean on her for support. And she is a Glencliff graduate. From Monroe Carroll Children's Hospital, Dr. Churchwell is here with us today, and some of his colleagues as well. We have several representatives from Metro Nashville Public Schools that are here today, members from the CDC, Metro Public Health Department, Alignment Nashville, the Nashville Chamber of Commerce, and I hope I've not forgotten anyone. Our special guests are here from the Department of Health and Human Services from Washington, D.C. I'm going to turn it over to Bill Orr, who was appointed by President Obama to be the Deputy Secretary. At this time, Bill Orr.
Good morning. I just finished a tour of one of the most impressive high schools I have ever seen. This is one magnificent place. And congratulations not only to the leadership of the school, but to the students. You have produced an amazing educational institution, and one that it appears has really been absorbed by the community, because the work that you're doing on prevention and putting wellness to work really requires the community's support. And it looks to me like Dr. Churchwell and so many others here, representative, is that this school is pulling the community together to address one of our most important national issues, which is our wellness and reducing obesity, encouraging nutrition education and physical activity. I'm delighted to be here to congratulate Nashville and Davidson County Metro Public Health Department on an award of $7.5 million for obesity prevention. This grant is part of a new $373 million program that has been funded through the Economic Recovery Act, and it is called Communities Putting Prevention to Work. And what I've just witnessed is how a community can do that. The reason the Nashville Health Department asked us to come to Glencliff was to make this new grant announcement, and I have been so pleased to be able to see the Wellness Center, the community garden. I want to come back in the spring when the community garden outside, which sounds like it's quite a large area, is in full bloom. You know, the First Lady has started a garden at the White House, and I hope she's going to be an example for schools all over the country. She has brought together students to help her do that, and they have harvested thousands of pounds of food. So she's creating a great model for us. It's critical that we get prevention and wellness programs established in communities, because poor nutrition and lack of physical activity is leading to chronic illness across the country. We have healthcare costs that we have to get under control, and one of the most important things we can do for our long term is to build prevention and wellness into our daily lives, and particularly the daily lives of our students and our young people. And that's why this school and Nashville is really setting a model for the entire country. One of the most important things about communities putting prevention to work is demonstrating how this gets done. We as a country have not focused on prevention, on nutrition, on physical activities in the ways that we need to for our well-being. And what we need now is for leadership. And that's what Nashville, the mayor, the Children's Hospital, and so many other leaders in the city. By bringing this all together, you all will be establishing the model for the rest of the country. Communities Putting Prevention to Work is also focusing on tobacco prevention in other communities, but there are only 44 communities that have been funded across the country. So we're looking to you to really help us take this to another level of understanding. Initiatives that are included in Nashville's effort include helping bicyclists and drivers share the road safely, getting more school-age kids to walk to school, creating oasis in food desert neighborhoods with community gardens and fresh produce. You are going to teach not only this community, but all of us, how to pull all this together to improve our health. The communities putting prevention to work represents more than half of the $650 million that has been set aside under the Recovery Act for prevention and wellness. So it's very important that we succeed from your leadership. There's been a very solid foundation established in Nashville. I've been hearing about the focus that the city has had and current Mayor Carl Dean has had with his Healthy Nashville Leadership Council in putting prevention to work. We know that Tennessee and Nashville and the entire country has a real challenge about our health through obesity, through lack of knowledge about nutrition, through lack of physical activity. We also know that it leads to chronic diseases that cost us a tremendous amount of money. 70% of the money that the Medicare program spends is on people who have chronic diseases, many of which are preventable. So our work begins at the earliest stages and certainly through schools. What you've done here in Nashville is so impressive. I look forward to coming back. This is a 2-year grant. I certainly look forward to coming back not only to Glencliff, but to the city to see how the progress has proceeded. President Obama and Secretary Sebelius committed that we were going to visit each of the 44 communities that have received these grants because we want to lend our full support and encouragement for the work that you're doing. And if I have one last word for you, it is show the nation how to do this. We're all looking to this school, and we're looking to Nashville to lead the way for the rest of the country. It is now my pleasure to introduce someone who's going to have a very important hand in guiding this whole initiative, as well as the work of the city, the Mayor's Director of Healthy Living, Toks Omishakin.
Good morning. Wow, an exciting morning at Glencliff. Really appreciate the tour that we just went on. Just saw some amazing things that are going on at this school. On behalf of Mayor Carl Dean, who couldn't be here today, and the City of Nashville and Glencliff High School, we want to thank you, Deputy Secretary Bill Corr, for visiting Nashville, for visiting Glencliff, and secondly, for believing in our work that we said we were going to do. HHS and the CDC have given us a rare opportunity. Several hundred cities and communities applied for this grant across the country, and we are one of 44, like Mr. Corr said. So it's a very special thing that we were able to get this money, this $7.5 million. So we really appreciate this opportunity. There's a lot of work that's going to be needed to get done. When you come back on your next visit, our obesity rates may not have dropped by 10 or 20%, but we hope that some of the programs that we've outlined are being implemented and are getting done. So we thank you. We thank the Department of Human and Health Services. We thank the CDC for believing in us and trusting that we'll be able to accomplish a lot of things that we set forth to accomplish. So thank you to Glencliff.